Hi, welcome to episode 7 of OSCE with Mundau ES. Today we will be doing blood pressure procedure. Blood pressure is the measuring of pressure which reflects the pressure of blood against the wall of the blood vessels. As in all procedures, start by washing your hands to prevent cross-infection. It is very important to greet your patient. This allows to build rapport. Immediately after greeting, introduce yourself and your assessors. This is to familiarize the patient with the staff around. Explain the whole procedure to the patient. This is to make sure that the patient gets to cooperate and understand what's expected of them. This includes if the procedure is going to be comfortable or not. Immediately when done with explaining the procedure, you may ask for consent from the patient so that you may proceed or not. Once consent is given, check the patient's comfort including condition to make sure that the patient is comfortable by asking their needs if they need to go to the loo before you start. Check also the immediate environment to make sure that the environment is safe and clean for the patient and for you to do the procedure. Also, go through the patient's documentation to check the instruction. What's needed? You're gonna need a sphygmomanometer with the correct size of the cuff for the patient, a stethoscope, antiseptic hand spray to make sure that you decontaminate your hands throughout the procedure, cotton wool swab so that you can be able to clean the stethoscope earpiece, receptacle bag to make sure that you discard all the general waste from your procedure. To begin, decontaminate your hand with antiseptic hand spray. To decontaminate or clean your equipment, use the cotton wool swab to clean the earpiece of the stethoscope, and also use the hand sanitizer or spray to sprinkle on the BB cuff so that you prevent cross-contamination. For testing, take one earpiece at a time in your ear and tap on the bell, which is known as the diaphragm, to hear for any sound. If there is sound, it means that it's functional. For the hand cuff, make sure that you tighten the screw of the sphygmomanometer and inflate. If it inflates, it means that it's functional, and release the air. To promote relaxation and to obtain correct readings, position your patient in a lateral side or a sitting position, and also remove any restrictive clothing from the arm and expose the upper arm, which you are going to use for your cuffing. Locate your brachial and radial pulse because they are the ones that you are going to do to determine your readings. Immediately when you found them, place your BP cuff on the upper arm, just immediately 2.5 to 3 centimeters above the antecubital fossa. Using your right hand or left hand fingers, place them on the radial pulse and inflate the cuff up until you don't hear the pulse. Once you don't hear the pulse, unscrew the valve slowly. With your finger still on the radial pulse, slowly deflate the cuff up until you hear the first beat on your fingers on the radial pulse. Then deflate completely. Now, place the bell of the stethoscope on the brachial pulse where the pulsation was felt, and place the earpiece of the stethoscope in your ears. Let's assume that the first pulse that you felt while deflating was 125. Now you will have to screw the valve again and inflate. And on addition of the 125 that you found, you're gonna pump or inflate up until 125 and add an additional 30 millimeter of mercury above the readings of 125 that you found, and it will now give you 155 readings. From there, deflate again, listening carefully into the stethoscope earpiece. You listen for the first beat that you will hear while you're deflating and the last beat that you will hear while you're still deflating. Your first beat while deflating is called the systolic, and the last beat while you're deflating is now called the diastolic. Once the cuff is fully deflated, you may remove the cuff from the patient's arm. If you have rolled up the patient's sleeve, make sure that you roll them down, allowing the patient to be comfortable. Ask the patient if they may be in need of any assistance before you continue with your work. Once more, after done with the patient, clean your stethoscope as you did before you began. Clean the earpiece using the cotton wool swab and also spray on the handcuff. This is to prevent cross-infection and to allow for the next usage for the next patient. Discard the swabs that you've used. Decontaminate your hands using antiseptic hand spray, as following the principles of hand wash that states that you should decontaminate your hands after being in touch with the patient. For feedback, give your patient a feedback about your findings, whether they were above, normal, or low, and thereafter give health education in according to the findings that you found. Immediately when done, compare your findings or your results with the previous ones or the baseline data that you found when you were reading the prescription. Interpret all the findings to your assessors. The principles of record keeping requires you to record everything you've done, record accurately, and do not forget to put your signature. When done, you can also go and report to the sister for any abnormalities observed.